This episode of the Bari Chronicles is proudly brought to you by Bariatric Support Australia.
Hi everyone, I'm Tash.
And I'm Damo.
And we are so excited to bring you this week's episode of the
Bari
Bari Chronicles. This week we are joined by Jennifer Tsoutsoulis, who is a wonderful dietitian from Dr. He's team in Melbourne. Thank you for being with us today, Jennifer.
Thank you for letting me join you on this podcast. Absolutely amazing.
We're so excited to be able to chat.
Yeah. So I guess let's start off, if we can, just what led you to dietetics and specifically to specialise with bariatric surgery?
100%. So I guess, finished high school and it was kind of one of those things. I loved food and I loved nutrition, and I was like, kind of just fell into dietetics a little bit there. And then, finished my degrees and ended up getting a job in kind of like a private practice clinic, but had a little bit of Bari in there. And I promise you, the first time I touched Bari, it wasn't an area that I was looking to move into. It was something I kind of, fell into a little bit, and I loved it. I absolutely loved it. And that was when I was just kind of like touching the surface of it. And I was living in Queensland at the time. And then I moved back to Melbourne and actually started working with Dr. He. So I've been with him now, I think it's almost 6 years now. So working with Melbourne Weight Loss Surgery. And predominantly our caseload is bariatric surgery. And I absolutely love it. You're able to support patients in the early stages on building those lifelong habits. And that's what I love about it the most, because we get to be there step by step of the way to kind of help them through all those challenges that they are facing.
Tash recently spoke with another surgeon based in Melbourne on habit building and, just how important that is. And, I always thought, I wish there's stuff that I had have known before I got to my surgery day that I could have been working on. Do you find that other patients have that similar sort of experience?
100%. I think the more we can kind of build on those habits earlier, the easier the journey is kind of post-surgery. And that's not saying you're going to cover all of the habits you need for surgery, but you're going to set yourself up for success. So I guess, in regards to the diet, in regards to your headspace with the psychology counseling side of things as well. And even if it is just building that routine in with exercise. So I think habits play such a, key role for that long-term picture as well.
So Jennifer, when it comes to somebody identifying that perhaps they want to go down a bariatric surgery pathway, what are some things that they could put in place or that they can start to implement in their life in order to help them ultimately achieve a really, really wonderful full life post-surgery? So what would you recommend to somebody that's just sort of starting out?
Yeah, 100%. And I guess there's so many different aspects of this we can talk about. So I'll focus on the diet side more than anything, because I guess that is my specialty. But I guess it's really trying to listen to your body cues and what you're looking for, because I think sometimes when we have focused on so much, food trauma through our lives as well, and food has become, the bad guy in our life as well, we have a lot of kind of relationships with food that we need to work through. And so I think it's understanding what is your hunger, fullness levels, trying to listen to your body and get back into understanding what that means. And I think as well, trying to, liberalize the diet a little bit more. Most of the patients we see have a lot of kind of, food rules or food restrictions that we have to work through. And I think if we can work through them prior to surgery, it actually makes the journey a little bit easier. Because yes, post-surgery, there are, restrictions, and there are some kind of guidelines we follow, especially in the early stages when we're in those texture modified diets. But the main goal for us kind of post-surgery is to get you to this balanced diet that's not what we consider a diet, but this is lifestyle. This is your new kind of the new you, your new way of living.
I love that. You just touched on something that I've heard the term before, and I get it. We have our support group and everything, but could you explain a bit more about food trauma?
Yeah, so I guess a lot of the patient groups that we see from a young age have battled with people telling them they shouldn't have something. So there's definitely a lot of weight loss programs out there or diet programs out there that say, I'm going to use carbohydrates. Carbohydrates are the bad guy. Do not touch them. They shouldn't make it on your plate. And they get such a bad rap, but they're not the bad guy. They have such an important role in our diet, and it's about finding that balance. So, from a young age, a lot of our patients have been on lifelong diets, from early ages. I've got patients, saying 10 years old, they've been put on a diet. Sometimes there's other bigger traumas that have come through, like, something's happened to them personally, and food is that comfort, that emotional kind of blanket for them. So more with the psychologist, it's kind of delving into understanding a lot of those kind of, those kind of traumas, and understanding how they use food and why they've used food. But I guess with the patient group we see, there are so many factors that play a role here. And I think it's really trying to understand all of that kind of leading into the journey, because if you understand why you use food, how you use food, and those restrictions you have, it's going to really support you when you do kind of have surgery. And then someone like a dietitian saying, hey, no, I really want you to start adding, to your plate, going, well, no, I've never touched that. That's something I shouldn't touch, and understanding why we're saying it. So I guess that's kind of where I would be working.
So what I love about that is, and having been a person that did grow up with all of the above and some very strict food rules that I had for myself, unpicking those is really challenging and very, very complicated. But can you give us some examples of ways that we could introduce those foods preoperatively, so that it's done in a healthy way?
100%. So I guess this is kind of prior to surgery, I guess, trying to you've got a bit of time to work on these habits. I guess it's kind of going, okay, well, what are my food rules? So sometimes it's, I can't have, any other fruit besides strawberries because it's got carbohydrates to it. And what I would be saying is, start just trying to slowly introduce some fruit, try different things, see how you feel. And I think it's also working with your team to understand, why do we look at something as bad or we shouldn't have it? Like, we're trying to find where that kind of stems from. So that slow introduction, understanding that all food has a place, and I think it's finding, like you said, everything's got a place, and it's just trying to find that balance of where it all fits. So, slowly kind of creating what we do with the food group kind of distribution on the bariatric plate as well. But, you've got your protein, you've got your kind of your fibre, your veggies, your salads, you've got your portion of carbohydrates, but starting to focus on really more the portion size of it and how it looks on the plate, rather than just trying to eliminate it completely.
Yeah. Yep. I totally agree with you. One of the things that I wish I had understood and done more of preoperatively and in my first 12 months was the understanding that carbs are not the devil, and that it is okay to actually have some. And I wish that I had understood the amount and the importance of having them, because it is something that I had eliminated to a very large degree, most carbs, but then obviously because I was doing restriction and elimination, I would then go on to want to binge, and it was just in a very unhelpful cycle to, in my own life. So I think that that's such a valuable tool.
Because surgery doesn't really fix that side of it, does it? It doesn't fix our relationship with food. If anything, it can make it worse, because suddenly we're not getting all the nutrients we need. And understanding the difference between simple carbs and complex carbs. And it's such a science, isn't it? Yeah.
It really is. And I think, working on it now prior to surgery, because when you have surgery, there's 1,001 other things you need to focus on, and that's an overwhelming journey on its own. And I think, I always say, the first 12 months of surgery, I call it a honeymoon. And now I know our patients are working hard in that time. I know it's still a challenging journey, but I say it's a honeymoon because this is when we also work on a lot of those habits and behaviors, because this is when they have the most level of restriction or the most appetite suppression. So it's a prime time to really work on that. But if you can imagine that we've already worked on that prior to surgery, then you have more time to work on some more strategies post-surgery. It's that perfect balance that you can kind of feel not as overwhelmed when you're going through all the other changes that come along with surgery as well.
I think what would you sort of suggest to someone that, you know, they might be listening and going, oh gosh, maybe there was some stuff, you know, may have sent me down this path. And because I know when I realised it, I was like, I should have dealt with that before I had my weight loss surgery. But I didn't even realise that there was like the whole mental health side to it. And I know after I had weight loss surgery, I was about 6 weeks out, and I literally felt like I'd lost my best friend, which was my comfort eating. But then I also had an issue where I couldn't eat very much, and I ended up needing a dilation done. If you have people that are sort of struggling with that, not being able to eat, you know, when would you say you need to let us know, or you need to say something? Because people, you know, we do tend to sort of bottle it up, and you know, I don't want to appear as a hypochondriac or something like that. And you know, we can really make ourselves suffer sometimes.
Yeah, 100%. I think the minute you have, I guess, any fears or even the feeling, like you said, you lost your friend, like, you know, food was that comfort for you. And I feel like definitely reach out to the team. Like early on, yes, there is an element of restriction there, and there, you know, if you're on a liquid diet, I can't modify completely what we can do. But then it's in the back of my mind going, I need to be able to support you down the track with this. What can we do? And even maybe just give you that reassurance that you're not going to be on this excessively restrictive diet for too long either, because I think that's a big fear that we get early on, is this all I'm going to eat for the rest of my life? I get some people go to me, I'm never going to touch a slice of bread again, am I? And I'm like, yeah, you will. Like, it's all going to come with time, but you just got to kind of, you know, work with the journey a little bit. So I think if you have any fears or you have any concerns that pop up, or like you said, like even discomfort and you're a bit concerned about it and you're going, I don't know, is this normal? Is this not normal? That's what a support team is there for. You know, with our clinic, we do offer quite a bit of support. So you'll have sessions with myself, the dietitian, we have nursing part of it, we have physicians, and you have your surgeon. So at any point, any concern, like even if you came to the dietitian and said, hey, Jen, I've got this feeling, and I looked and I go, reviewed the diet, don't think it's me, I then pass it and escalate it up and up and up. And so you just keep moving up the chain until we figure out what's going on. And I think the minute you get a concern, reach out, because that's what we're here for.
Yeah, that's excellent advice. You said something right back sort of nearly at the very beginning of our podcast about managing hunger and fullness signals. Now, can you explain what they are, what they might be, and how to do that? Because I don't think in my adult life I had ever actually really felt hungry. I think I had a steady stream of food always going in, and I don't think I ever truly knew that might sound really odd, but I don't think I ever really experienced what hunger truly was, because I was pretty much always eating. So I'm sure that there are other people, because I've been asked that question. How do I know what a hunger cue is? How do I know what a full cue is?
100%. And it's actually more challenging during surgery as well. So I guess, you know, as adults, we learn to ignore the cues, and that's probably what happens most. So we say most kids are probably the best at understanding it. So, you know, when you get like a toddler and they go, I'm not hungry anymore, push the food away, they're great at it because they know their hunger and fullness. Or, hey, I need a snack, and they grab it. But as we get older, we kind of start shutting it off a little bit, and we stop listening to it. And, you know, comes with a lot of, like I said, food traumas and other kind of diet restrictions as well. We learn to shut those cues off, like, nope, that's not hunger, just ignore it, push it away. So it is really hard to kind of reconnect with it. For my patients post-surgery, I kind of tell them, to get comfortable with being uncomfortable. So, and what I mean by that is just to sit with the feeling and ask yourself, what am I looking for right now? So, we're on autopilot, 3 o'clock hits, it's time to grab a snack. We haven't thought twice about why we're grabbing that snack, but it's 3 o'clock, so we've grabbed it. So it's not telling them that they can't have a snack at 3 o'clock, but what I get them to do is I want you to sit with the feeling and ask yourself, what are you actually looking for right now? Is it that you've got that stomach rumbling, that urge, that lightheadedness, and it's been, 3 to 4 hours since you last ate? More than likely, you are physically hungry. Let's go and get you something.
Right.
Or is it, you ate an hour ago, but you've had a really, really bad day at work? Or, it is just a habit. 3 o'clock comes around and, it used to be 3 o'clock when you came home from school, you grabbed a snack at 3 o'clock. So you're in that habit at 3 o'clock, let's grab a snack. So I kind of tell my patients, before you grab that snack, don't take it as I'm stopping you. The snack is there if we want it, but I want you to sit with that feeling. And like, it's going to get uncomfortable. All of our cravings and, I guess, urges we have are sitting up here when we kind of, initially feel them. And I'm like, by sitting with that feeling, even if it is for 15 to 20 minutes, that you just sit there and you say, what am I actually looking for? And it could be just even, writing in a journal. It might even be just, stepping out away from the food, go for a walk or do something you enjoy for that 15, 20 minutes. That urge or craving is probably going to reduce down. It's not going to be zero. You're probably still going to have a bit of a craving there, an urge for something, but you're better able to process it rather than when it's up here at a 10. So by giving yourself that time to get comfortable with feeling a little bit uncomfortable with that feeling, it gives you that time to think about what you actually need. Does that help out a little bit?
That's actually excellent. So, and that is something that we could practice preoperatively as well.
100%.
That will lead into probably a more easy transition for post-op. And that's actually something that I personally do practice now. And I'm particularly aware of it if it's been a bad day and I find myself dancing around in the pantry.
Yeah.
Going,
doing the pantry dance.
I ate about an hour ago. It is usually about an hour, and I find myself standing there, and then I've learned to ask myself, why am I here?
Actually, something that you said about, children are really good at regulating that, and just this morning we had a rushed morning, so we went through Macca's on our way to school to drop our daughter off and got her usual, but she'd eaten about a third of her burger, and she passed it over to me and said, "Oh, Dad, can you put this back in the bag?" And I said, "Oh, are you still hungry? Do you need more time before you go?" And she said, "No, I'm not hungry. I've had enough." And I was just like, oh my God, because I could not do that as a 14-year-old. I would have finished it and still been looking for, what else can I have with it? And I was just like, wow. So she's starting to really listen to her body and what she's wanting, and also understanding her full cues.
And I think that's a positive on you as well, though, because a lot of parents, especially the older generation, if, the kid said, I don't want anymore, it's no, you're going to finish that. Like, you got to finish what's on your plate or finish, what we've purchased. And I think that's another kind of, I guess, unpacking another kind of trauma as kids we get. And that's when we stop becoming so in tune to it, because instead of going, I am full, let's put it away, it's going, I'm full, I'm feeling stuffed, but I need to finish this, because if I want to get up, and maybe it was, if you finish your meal, you get dessert at the end of the night, or if you finish your meal, you get to go to such and such's house, or whatever it was that it was built into that. But, and that's the thing, like, because, I'm not saying you've had that kind of history growing up as a child as well, but
we do.
Yeah.
And I think that's why we were sort of aware of it.
Very mindful with our children to not do that.
Yeah.
And I think that's such a positive generation we're kind of pulling forward, because we're a bit more food aware and aware that it is okay to leave things behind. So I think you see those generational changes that do come through.
Yeah, I mean, that's something that my wife and I have talked about, is how powerful it is to be able to get up and walk away from your plate, and you're okay with that. It doesn't cause me anxiety anymore. My wife, she's had gastric sleeve as well, and we went out for a coffee yesterday, and we shared an eggs on toast, and there was still leftovers with it. We couldn't finish it even. But I don't feel bad anymore for not finishing it. Whereas before there would be a level of guilt because we've paid money for this, and that would cause me to keep eating until everything was finished. And there were times where it was maybe my daughter and my wife, I'd be eating their leftovers as well, feeling like I had to.
100%. And I think that's, something, even I guess when we're talking kind of prior to surgery, that is something to work on as well. If you do feel like you've got that anxiety or guilt if you are leaving food behind, just start getting in the habit of going, eat my meal, and then if the kids have got leftovers and you don't want to throw it out, maybe it is just putting it in some takeaway containers and going, you can come back to this the next day. Or like I said, it's all about getting comfortable with being uncomfortable, because that's what we're doing. We're pushing barriers and we are becoming situations that are uncomfortable. We're trying to put ourselves into them a lot more. And I think, if we do start working on that early on, it's going to make a lot of difference post-surgery, because there's a lot of more uncomfortable things we go through with surgery as well.
There sure is. Just speaking of uncomfortable things, this is a topic that is really hardly ever discussed. And I don't think we've actually talked about it before, but the role of fibre in the diet, particularly in those first 6 weeks. Now I know that I don't think we've ever discussed it on a podcast before, but we see it all the time in our support group. People struggling in those first 6 weeks with with frequency of bowel motions, with changes in that particular area, and nobody's talking about it. So do you mind if we just talk about that a little bit?
And look, bowels are my favorite topic, so you're on the perfect topic.
Oh, great.
And we've got so many protocols at work because of this, because we've gone from eating, even pre-op, we're on a liquid diet. Those shakes are quite low in fibre as well. So just pre-surgery, low fibre intake. Then we're moving you to post-surgery, low fibre intake, small portions. Like I've got a little bowl here. This is a quarter of a cup we're looking at, for the first kind of period of time. So small portions, we can't eat enough fibre, and our fibre requirements are ridiculously high. So how are we meant to hit these beautiful goals and get regular bowels when we can't eat that much food? So we do recommend a regular fibre supplement.
Okay.
The challenge is that we're trying to get at least 1 litre of fluids in first, and that does take some time. So we do use a bit of laxatives as well in the first couple of weeks until the fluid intake can kind of increase. So our goal is, within our clinic, we do about 2 serves of fibre a day. So at least they're getting just a start up with fibre in the diet, just to kind of get the ball rolling a little bit. We typically, and this is not something everyone needs to use, we start off with Movicol, a little bit more of a gentle laxative, just to kind of draw some fluid in there and soften things up. But we adjust the protocol for person to person, but definitely getting on a fibre supplement. The same way we get people on a protein powder, fibre is just as important, but it is missed off a little bit, but it's definitely something that is needed, and no one's going to be hitting fibre requirements without a fibre supplement there.
Yeah, 100%. I mean, I've just seen so many posts, even just in the last couple of weeks, about constipation, about people wondering, what should I be doing with fibre? We hear so much about protein. Everyone wants to talk about protein. We're all proteined up to our back teeth, with so much information, but we really need to be helping our body in terms of having fibre too.
And that's why, early on, when you can't get a lot of, bit of a bias split. Like you said, protein is the main goal. It is, we say about 70% protein, 30% veg to start off with per meal. And then initially, where do you get the snacks in with your fluids in and everything else? So the fibers, powders are going to be really essential. So as the diet progresses, you can get a lot more dietary fiber in there as you kind of progress through surgery, but fiber supplements still play a role at that time. I even think prior to surgery, most of us aren't hitting our fiber requirements anyway. So, it's definitely something that does get missed, but it has such a benefit as well.
Oh, look, I agree. Now, for people that have celiac, for people that have, other conditions, what would you? So I am a celiac. What would you say to somebody, like me, that obviously is probably going to find it even more difficult and challenging to get the right amount of fiber?
100%. And I think it's working with alternative products. So definitely still putting you on a fiber supplement, but one that doesn't contain gluten in it. So just checking over and make sure that's all okay. So definitely a fiber supplement. Probably will need a little bit more fiber because you do have more of an element of malabsorption happening as well. So keeping that in mind. And, it might be finding that balance with the diet as well as we progress. We probably do need to play around with a few more things. We find kiwi fruit works really well for constipation. So getting a bit of kiwi fruit in there, there's no issue there. So it's definitely personalizing for the individual and their situation. And we've got many people on different kind of protocols, like this fiber supplement doesn't work for me, so we've swapped them to an alternative one. Let's try this one out. So it is trial and error, like most things are with kind of, bariatric surgery. We're trying different things and seeing how things go because no one is the same. But yes, definitely probably a little bit more of a requirement because there is a bit more of a malabsorption.
Isn't it funny what you were saying about children and their understanding of full cues and things? My children are all obsessed with kiwi fruit, and they actually eat them skin on. And the oldest, my oldest son was just saying to me yesterday, he was talking to me about fiber, and he's like, "These things are just fantastic." And I said, "Why do you know that?" But okay.
You know what? And that's such a good thing. And I think, and like the school kind of side of things, there is a bit more of that health promotion. My sister's a teacher and, she's talked to me about a few of those things in regards to that kind of health side and focusing on that side. So I think it's important that it's more embedded into what we learn. Like I remember going through school. I don't think we touched it until I was hitting kind of probably the like end of year 12 VCE days that, I started choosing more of those subjects to focus on, but it wasn't something that was focused on. It was just, you got your school canteen there, which has everything there, but there was no kind of nutrition knowledge passed on.
Yeah, I agree. So when it comes to that, what are the important nutrition goals that people should be focusing on immediately after their surgery? What do you tell your patients?
So immediately after, definitely protein is our main goal. Like, we've got significant weight loss in a very short period of time, significant muscle mass, and your requirements are quite high when you're eating such a small amount. So protein is number one, but it isn't the only one. So then it definitely is bumping things up like your fiber. So we definitely, like I said, we use fiber powders as well within our clinic. We definitely start building the diet up. So we definitely say if someone just goes, "Oh, I'm just eating protein everywhere," we're like, no, we need to get those veggies in there as well. Like they do play an important role. A little bit of a bias split in the early stages, but we do balance that out as we continue to progress. So protein and fiber are your main two in the early stages. All of our patients are on complete kind of bariatric multivitamins because nutritionally, there is no way we're getting enough nutrition in from our diet alone. So definitely the supplement size covers a lot of those vitamin mineral markers for us as well.
That's all very excellent. I'm always fascinated by the way that we can become so focused on one particular thing that we forget about other things. I know for me, I was always torn between protein and everything else, and even when it came to particularly puree stage, I found it difficult to know how I was going to get enough water in to be able to keep myself hydrated, still having enough protein. So could you perhaps break down what you find a normal day might look like in terms of food?
Yeah, 100%. So yes, definitely in the texture modified side. We'll kind of start, we'll say with the puree stage, because I guess that's probably one of the biggest challenges. So typically with our patient group, we do just focus on your 3 main meals a day. So your breakfast, your lunch, your dinner, around 1/4 cup portion, about 70% protein, 30% veg.
Yeah.
Now, between the meals is kind of hydration time. So early on, we do recommend limiting snacks between the meals. And the reason for that is, where does the fluids come if we're snacking? So between the meals is really our hydration time. And in those water bottles, one thing I say to them is add your protein, add your fiber, make a really special drink for yourself. Because if you can add, we do about 2 serves of protein powder a day, so about 30 grams just on top. Everyone's different though, but these are just like basics. And then 2 serves of fibre a day. And it just kind of builds the gap a little bit more. So it kind of helps to get everything in when everything is so restricted. Because if we start having those snacks between the meals, you got to wait 20 to 30 minutes between food and fluids.
Exactly.
Where are you going to get everything in? So if you just kind of create, like I said, early on, it's a bit more restrictive, but we do liberalize that. But it just helps to make sure we do get all that in.
I think that that's very, very helpful for people to be able to just think about, because I found the mental load of the puree stage was really quite taxing, and I got actually anxious about it, because I kept thinking, well, if I have any type of puree now, then I can't have anything half an hour either side of it, and then it's nearly time to eat again, and what am I going to do? And I'm clearly dehydrated as well. I'm going to, just didn't cope.
It's
so
yeah,
that's
ridiculously
really good.
hard. Yeah, it is. It's ridiculously hard. We are asking these patients to kind of come in, change everything. A pureed meal as well. Most people don't find it appealing to have a pureed meal. We get a pretty quick transition in our clinic. It's about a week on puree, so we do move them through it a bit quicker. So it's my highlight. I'm like, just do a week for me. Just make sure you can tolerate it so I can move you on. But it's a challenge, because we throw so many things at you. Pull your portion size down. Get your hydration in. Get your protein in. Get your fiber in. Focus on pureed meals in the middle of that as well. And then it's overwhelming as a big kind of journey that you're about to go on. And I think having the support team, and I think you guys do an amazing job of it, is like really supporting your patients to have that knowledge about what's to come, but also the support team within your kind of clinic, if they've got it as well, is like fundamental, because it's such a challenge to move through all of these stages on your own.
I don't know how people do it. I know how much I struggled, because I didn't have, it was just my surgeon back when I had it. And the stuff that I struggled with. And I look now and think, there is so much information. There's so many amazing clinics that deal with the whole thing. I think if we want to make the most of our surgery, then we need that team support.
100%. And I think, like the clinic I work in, I am lucky because we've got a really great multidisciplinary kind of approach in there. But, if anything pops up on my side that I'm not sure about, I can tell you right now, I can jump into Michael's room and say, hey, got this case, not sure where to go with this. And then, we have those open discussions with the nursing team as well. And I think it's beneficial for us as like clinicians as well, working with the patients. So we're giving them the best quality of care, but it's also so beneficial for the patient, because if the nurse in the nurse appointment, they kind of focus on and they go, hey, I'm really struggling with getting, my supplements in, they know they can, hand over to the dietitian and say, hey, have you got any strategies or tips that you can help me out with? And, vice versa. So I think, having that team there, I really don't know how people can do it without a team. Like, I think it's a big journey without that support.
Agreed. When it comes to that 1/4 cup measurement, is that the size that you sort of recommend throughout that healing phase?
So it definitely is. It varies for everyone. So our typical guidelines, I can show you my pretty little bowls that I have next to me.
Yeah, we'd love to see them.
Got little demonstrations in here. 1/4 cup for about the first 3 months.
Yeah.
6 months, they kind of move up to about 1/2 cup.
Yeah.
And then it's about 3/4 cup at 9 months, and then 12 months, about 1 cup.
Yeah.
But everyone is different. There's transition phases between this, you know, and even though we talk about, you know, the first 3 meals, you know, between the meals, there might be some snacks coming in, especially if you start building exercise in there. You can't just have your 3 meals a day. And we say these are guides, but it's about listening to your body and, you know, really, I guess, like we spoke about before, understanding those hunger cues as much as we can. You know, what are we actually needing at that time? So as a guideline, that's kind of what we use and the kind of transition we see come through, but everyone is different. Revisional procedures as well, their portion sizes sometimes tend to be a little bit more than someone that is their initial procedure, we do find as well.
So off topic a little bit, quite often we get people talking about moderation, and the word moderation has sort of been the bane of my existence because I never knew what moderation was. I never understood moderation. Yet we hear it all the time. Oh, you can have sort of whatever you want in moderation. So can you, like, how would you break that down
Explain
for someone
moderation.
who has no idea? You know, my moderation for a packet of biscuits was the end of the packet.
It is a very, very hard question you've just thrown at me, so thank you. But no, moderation is hard to explain because, like you said, everyone is different. With the patients I work with, I guess it's about finding that balance that if they want something, they can have it and they can enjoy it. Most nights I eat chocolate. I enjoy it, I love it, and I move forward from it. And I want to get my patients to that aspect of it, that if you said to me, Jen, I love a Tim Tam, go and have a Tim Tam. Now, what I would focus on with you, though, that it's not eating the whole packet of Tim Tams, is going, okay, so you want a Tim Tam, and we're, I guess, checking into what we're actually craving at that time. We've got a craving for a Tim Tam and we want it. Great. Grab the Tim Tam, pair it with something that has a bit of protein and fibre to it. So that's what the filler is, but you've hit your craving as well with that Tim Tam. Moderation, it's hard. Like, I don't think there is one simple answer for what it is, but I think it's about, you can still have things that you have cravings for, but finding that balance that it is, you've enjoyed it, you're feeling comfortable with the portion you've had, and like taking away that guilt that those food options that we call have them in moderation that we give them. So still just finding that balance there.
No, I love that. That's great.
Yeah, I think that is helpful because a lot of times too, moderation, or I'm having something in moderation when it possibly is starting to turn into something that is causing a difficulty. I know for myself that is when I question, is this actually a moderate amount of whatever it is for me? Am I consuming a moderate amount of this if it is starting to affect me? You know, if I'm questioning my choice, if I'm noticing some sort of a marked change in the scales or whatever, then I might question, am I doing this moderately? But that's just how I'm processing it now at 6 years post-op, and I feel like I'm still learning because, like Damo, I didn't really understand what it was either at all.
I think we do, like 100%, as like dietitians as well, sometimes we probably do throw out some words and go, you know, you can have this moderately. And I think, you know, as you know, I've been in the field of bariatrics now for quite a bit of time, but I've definitely worked with kind of patients now and actually breaking that down and going, okay, we're just going to focus on that, you know, that nighttime snacking time and really understand what that is. Like, we could spend quite a few sessions on just focusing there, and it's never in my thing I've ever said you can't have it. I say, I want you to understand it. I want you to really understand what part of it, like, where does this kind of fit into your life? Why are we looking for it? Because end of the day, if it is that you've had a really bad day at work and it's every single day that it's a bad day, and then every single night you're coming home and looking for something, by me saying get rid of that snack, that's not fixing the problem, because the problem is actually with work, for example. So then it's about, let's actually go to the root cause of it. Is there something we can change in, not that I personally can change it for them, but in that work environment? And then you might even just find that kind of that nighttime snacking, you feel more balanced there because you've understood why it's there.
Yeah.
I love that.
I completely agree. Couldn't agree with you more. It's such a balanced, excellent explanation. Thank you.
Yeah, so I think, like, for me, I would take that and think, so the minimum amount that I could have of something but feel satisfied with it, and that would be sort of a moderate amount for me, and not doing that every single day or, 3 times a day or.
Yeah. And, finding that balance and, it definitely is like if you do find that, you're then going, I'm just going to use Tim Tams as an example, but, you're looking for Tim Tams at every point in the day, then something is missing somewhere, It's about, that's where that kind of reflection and getting uncomfortable, getting comfortable with feeling uncomfortable in those situations comes in, because you can then break down, actually, there's a reason I'm looking for this Tim Tam. Let's kind of delve into that. So it definitely does help.
Yeah, that's excellent. I do have one more question for you, which is, it's nearly Christmas time, and we have all of the the end of year do's, the parties, all of those things. What are your 3 top tips for people that are on a bariatric journey to be able to not just survive but thrive during the festive season? So what are some things that they can do to make life easier for themselves?
I guess it depends what kind of situation. So, for example, if they are going out somewhere else to eat, like, to a restaurant or something, one tip I use in Christmas season and also not in Christmas season is always ask for a smaller plate or kind of bowl on the side when they measure their meals out. So they don't feel as kind of overwhelmed by this, bigger plate coming in front of them. Get a smaller plate next to you. That way you can portion out what you need. So that would probably be my first goal. Always kind of ask for that smaller plate and bowl. That way you can portion yourself out, because in that festive season, you're talking, you're enjoying yourself. You're probably not as focused on what you're eating. So if you prepare your meal in advance, you've got a little bit more kind of portion control happening there.
Yep, love that.
My second one is don't say no to yourself. If you would like something, go enjoy it. A lot of people I feel coming to Christmas going, oh, my auntie's making like a pavlova, for example, but I can't have it because I've had surgery. And it's not saying no to yourself. It's about finding that balance we've talked about. So don't feel like just because it is Christmas or, you're going out that you have to miss out, but it's about finding that balance within those meals. Number 3, what else would I say? Got me on the spot.
That's okay.
Trying to think now. And another thing could be even just contacting people in advance. So, for example, if you're doing it at, a friend's house or like an auntie's house, just calling in advance and saying, hey, I just want to check what you are making. And, especially if you're in the texture stage and there isn't as much available, just say, hey, don't worry, I'll bring my own food. Or even just kind of going, maybe you can bring your own food there, or maybe they can make something for you that will suit your kind of, I guess, your tolerance and your requirements at that stage as well. So checking in advance as well.
That is great. They're all excellent tips.
Yeah.
Brilliant.
Beautiful.
Jennifer, thank you so much for joining us on the Bari Chronicles.
We've loved having you.
Had a great time, and hopefully we can do this again next year.
Yeah, no, it's been an absolute pleasure, and thank you for having me here.